Good afternoon, ladies and gentlemen. It's a particular pleasure, I have to say, to see so many people here today. It was rather ominous. My last face-to-face meeting was in Dubai last February, but the day had meant something to me. It was February the 29th. So I was worrying that it might be 4 years until we had another meeting that we could see people face-to-face, but at least we've managed it here, and it's a great pleasure to welcome you all to this 18th meeting of the Malvern Diabetic Foot Conferences. These were started by Henry Connor and myself, and I gave the first introduction in May 1986, the other side of this stage, because originally the meetings were held in this area. But this year, we've come back here for obvious reasons. We're COVID compliant, which is very important, and you'll see all the precautions that have been taken so we can look after everybody's health and safety. So on those few notes, I'm going to go through a few housekeeping points. You saw the notice about continuing medical education, or CPD. Please do not forget, if you wish to get these, to sign in every day, and they're listed up there in alphabetical order to show that you've been here, and there's 10 hours of credits available from this meeting. I've got a slide here with a few points. The mask wearing remains compulsory, as you know. It was just being debated in the House of Commons, and you can guess which side people were taking. I was watching that just for 5 minutes at lunchtime. So please wear a mask all the time, except, obviously, when dining or outside, or, of course, we're allowed when speaking not to wear a mask, because it's rather difficult to be precise and coherent often and to be heard. So masks, and there are sanitation points throughout. If people are worried, we have the ability to do lateral flow tests, temperature monitoring. We've got everything here in case anybody has some anxiety, and keep in touch with the office. Maggie and Julia are in the office, which is near the Shore Suite, just to the left of reception. You'll find the office just down there. Unfortunately, we're not allowed to have the wine reception, so many of you are used to. Our good friend Camillo Barato from Italy, who sent me a letter this morning, a WhatsApp text, saying he looks forward to beating England in the football on Sunday. But he's sorry he cannot be here, but the Prosecco that has been sent is being put aside for next year, so it'll be well matured. So we cannot have a reception. Apologies for that. And the lunch, everybody has to be seated, COVID compliant, cannot be walking around eating or drinking. So for the delegates, that'll be in the main restaurant, which is one floor above here and can be accessed through one flight of stairs to the right out of here. The breaks, again, we have to have strict rules for coffee and tea breaks, and that again will be, I think, in the restaurant, but you've got all of this in your packs and the seat. We can't have a formal program, so you've got a sheet of all the talks and all the details of what's required. Our exhibitors are our friends and they're our supporters, and it's so important that we keep in touch with them and you keep in touch with them. Please do visit them. We cannot, as you know, many of you have been to the previous meetings over there at the Winter Gardens and the theatres, where we have a large exhibition hall. Here they're split into 3 rooms. One is the Shore Suite to the left of reception, and many of you have been visiting already. But we do please ask you, because we want to have a back to normal meeting next year, and I'll give you the dates at the end of this talk, and we really need your support to go and show your interest in what they have to show about recent studies of their varying products. So please do visit the exhibitors at coffee breaks, but you can't take your coffee with you. We normally give coffee in the exhibit room, but that's not allowed. So we're being very adherent to the rules. So please do visit them. The CME I've mentioned, and those of you who are giving talks, especially those of you who are giving the 5-minute abstract presentations tomorrow, please, if at all possible, get your slides to our friends up here, just to the right. You can see the AV area there to the right at the top of the steps. So please get your slides in. We're still lacking one for this afternoon, but at least it's not in the first session. Now, Mike Edmonds, our very good friend, and I was talking to him on the phone on Sunday, and he said it's remarkable. We first met, I think, at a meeting in 1979, and we've both been working in the diabetic foot area since then, and we've become very good friends. And he wrote this very nice article. I'm just going to whip through just a few things to give you a foretaste of what's to come in the next 2 days. So he gave this very nice article here, you see on this slide, called A Renaissance of Diabetic Foot Care in the Lancet Diabetes Endocrinology, which did accompany a couple of very interesting new papers showing evidence base for some of the treatments we use. And so it's relevant recent guidelines on the design of randomized controlled trials for putative new therapies are being observed. And he was talking about trials that are really well designed and are helping us guide us in the therapy of difficult to handle diabetic foot ulcers. And of course, one of these is from one of our speakers and colleagues, Fran Game and William Jeffcoat et al. And this was the Leucopatch system, which, as you know, is bedside centrifugation of a disc of autologous leukocytes, platelets, and fibrin, then applied to the ulcer. This will be discussed in detail by Fran later in this meeting, as well by Mike, the sucrose octasulfate dressing in neuroischemic ulcers, the first evidence-based therapy for a neuroischemic ulcer. So I believe that these have been important developments since our last meeting 2 years ago. Or 3 years ago, sorry, this is 2020 meeting. Just like Euro 2020, this is Diabetic Foot 2020, some 14 months late. And then, of course, we have topical oxygen devices. Now, some of you may have heard the somewhat entertaining debate that I spoke at last year, 2 years ago, rather, at the Den Haag, the Hague International Diabetic Foot meeting on hyperbaric oxygen, myth or reality. I was fortunate to have the myth side of that argument, which I think I probably won. But this isn't true for some newer treatments that are coming out for topical oxygen devices. And you'll hear our friend Bob Freiberg, sadly can't be with us for obvious reasons, but pre-recorded talk later in this about one of these. This is the TWO system, and AOT is one of our platinum sponsors, as is Ergo, who make the sucrose octasulfate. But this study showed in an RCT that topical oxygen, intermittent pressure, was beneficial in the management of difficult-to-heal diabetic foot ulcers. So more of that you will hear during the meeting. Infection, you will hear straight from the horse's mouth, from the first author of this very important study, the Aviva study, which really challenges our approach to osteomyelitis in diabetes, although most of these patients didn't have diabetes, but this is the Aviva oral versus intravenous antibiotics, suggesting that oral antibiotics are just as efficacious. But you'll hear details of this study, again, from the author, Dr. Lee. Now, nothing's really new in medicine, it's rediscovered, and we're all talking about new pressure measuring devices, but you look at our friend Dr. Paul Brand, who was working in India and later in the Carville, the leprosy center in the United States, and he said that pressure is the critical quantity that determines the harm done by the force. And here is Dr. Brand working away in Carville, and this paper was published many years ago in 1963. And we validated this system, the PressureStat, or it was previously called, I can't remember what it was called anyway, we call it PressureStat now. Podotrat was the original name, I think. And this is a simple pressure measuring mat which can help the patient, if they look, the dark is dangerous. So it's a message. But now, of course, we've come to much more advanced systems of pressure monitoring. And you can say, see it, save it. Help the person with diabetes with insensitivity realize that there's something different from their foot pressure than their partners or whoever else. And then temperature sensing. Again, nothing is new in medicine. And again, it's like Dr. Brand, 1975, 44, 46 years ago. Infrared thermography contributes to the care of the insensate limb. It can detect through heat areas of irritated skin prior to breakdown. The foot warms up before it breaks down. So there, of course, are advanced methods, but this was from Brand's original paper. This has probably been lying on a surgical ward, not being turned, this heel of someone with diabetes. And this is a warm area, so the foot warms up, inflammation. Can temperature rise be a predictor of ulcers? And now we have smart MAC technology, and again, Bob Freiberg published this paper just a few years ago, and now the randomized trials are going on. And this is a simple bath mat measuring temperatures, and plantar temperature asymmetries predicted foot ulcer episodes. 97% of all foot ulcers were correctly predicted using a 2.2 degrees Celsius differentiation. So this is the future, perhaps, smart technology. So times are changing from patient empowerment through smart technology. The traditional one here You see the patient goes to see the doctor, careful examination, and a prescription is made by somebody else, etc. And now a lot of this can be done by wireless techniques, Bluetooth, whatever. So the solution could be continuous foot monitoring systems for people at risk of foot ulcers. A real-time sensor wireless device for the diabetic foot, perhaps. Seeing is believing. Help the patient see their own feet. And this is one device we're working on with colleagues in the States, the Tempstat, which can monitor like simply on a bar scale, and the patient then can see their own thermogram. A few years ago, this company, a small startup company, Siren Care in the United States, this is David Armstrong's slide, so excuse the humor, success at the Consumer Electronics Show, how the Diabetic Foot smart socks took over the Consumer Electronics Show that year, and they won the prize for the best innovation. And this was simple socks that could monitor foot temperature and feed it back to the patient. So the future is interesting. So smart technologies for prevention, looking at foot temperatures, or parameter pressure monitoring, or both. So I think at next year's meeting, we'll be focusing quite a lot more on prevention and looking at preventing not only recurrent ulcers, but first ulcers. So let me end with a couple of quotes. Edward Wilson wrote these words: "You teach me and I forget. You show me and I remember," so these slides are a little more helpful, "but you involve me and I understand." So I think we increasingly will be getting our patients involved with their own foot care using smart technologies so they can have continuous monitoring. But perhaps this is the best statement from the book of Ecclesiasticus in the Bible. Before you speak, learn, but before you fall ill, take care of your health. So this could be our motto going forward for diabetic foot care in the next year before we meet again in Malvern. And this is the Malvern, and this is drawn by Heather Freiberg. She loves this place, and they're so upset they cannot be here this year. They didn't want to self-isolate for 10 days, which is understandable. So this is her sketch we use on our program, where we have a program, and this is the sketch. And the meeting will be here next year, either in the theatres or even here. It depends how this goes. We also have coming up a virtual congress on diabetic complications at the IDF. If you're interested in this, go to the IDF website. We're taking abstracts. It's a virtual meeting. There is one entire track of 5 days on neuropathy and diabetic foot. We welcome abstracts, and this is going to be very cheap to register for in contrast to other large meetings, because obviously IDF is catering for people across the world and many people from low and middle income countries and so on. So this is the IDF Virtual Congress. These are future congresses with an interest in the diabetic foot, and I'm going to stop there.